Hello, following on from our squat series, we're focusing on the lower leg and looking at common knee problems. And we're looking at meniscal injuries today and whether you should or shouldn't go down the surgical route when you've got this. We're going to talk a bit about what the meniscus is. We're going to talk about when you probably may not want to get surgery on it and when it may be a little bit more indicated. And if we could ask a massive favour just to give us a like on the video, that's really going to help us out and help us connect to more people that might be helped by this video. Okay, so first off, Ant, talk us a little bit about what the meniscus is.
Yeah, so the meniscus is it's a type of fibrous cartilage which is situated between the tibia and the femur, so your shin bone and your thigh bone. There is a medial and lateral meniscus, which means it's one situated on the inside and one situated on the outside that sits on top of the tibia. The main role of the meniscus is to evenly distribute forces throughout the knee and to act as a stabilizer. At birth, our meniscus has a full blood supply, meaning it's fully vascularized. And as we get older, this vascularization reduces, which from the inside of the meniscus becomes less and less, which is also known as the white area. And the outside of the meniscus stays relatively vascularized. This means that it would likely heal a lot more either quicker or efficiently than what would actually happen if we had an injury within the white area. So injuries are very common within the meniscus, and these are normally due to sporting injuries or work-related injuries and repetitive kind of sports impact type activities. This could be done by rotation or purely blunt force. But most commonly, meniscus injuries occur just through the aging process. This means as we get older, the joint will tend to wear due to either arthritic changes, which commonly also affect the meniscus. So when we sustain injuries to the meniscus, normally two options are available. So you could either go down the conservative route, which is rehab, exercise with your physiotherapist or strength and conditioning coach, or you could go down the surgical option. So Rob, we've got surgical and conservative options. Do you find that there's one better than the other?
Yeah, so you've got a meniscal injury. You've been told that that's the case. You've got some people telling you should go down the surgical route, and you've got others telling you that you shouldn't do that. So what's the deal? The first point is going through how it's been diagnosed. So we spoke in a previous video about low back pain, the problem sometimes with MRIs and diagnosis. So if you just had an MRI, sometimes that's not always the best indicator that this is the main problem of the knee. And the last thing you'd want is to get surgery on a meniscus and it's not the actual problem. So it's been found that around 30% of people can have meniscal injuries with no pain at all. So it's whether it's coming from a different area. So really what we want is that image combined with some history of how it might have happened and an assessment so we can really see, is that the cause of your pain or not? So whether you go down the surgical route or not is a long recovery for this kind of thing. And you'll have to do a lot of rehab even post-surgery because there is a protocol that you need to follow. And either way, the rehab can last several months. But there has been a growing body of evidence that's suggesting that there's not much difference whether you go down the surgical or just the rehab route over a longer period of time. A 2018 study showed there was no difference whether you had surgery or went down the rehab route on knee pain and function. And it suggested that surgery should be used for those that didn't respond to rehab in the first instance. Other studies have shown a better response with surgery short term, say after 6 months, but then no difference when looking more 12 months into the future. So there may be a potential benefit going down the surgical route for a short-term option. However, it might actually then give worse results longer term compared to the rehab. The reason for this is if we're taking a bit of the meniscus away, like having a meniscectomy, it means that it can reduce the stability of the knee and change the forces that are going through it. It can also mean that the bone underneath gets a little bit exposed, which can then increase the prevalence of osteoarthritis later in life. So really, long-term rehab is the better option here. However, there are potential situations where surgery is going to be a bit more indicated. And Martinez, what do we tend to find is the better times to go down that surgical route?
So yeah, Rob, sometimes we do need an operation. So people that benefit from operation tend to be young and active. Most likely they sustain an injury, and this injury usually is a rotational injury when the foot is planted. Now, it's always beneficial to try conservative management, which is physiotherapy and medication and all of these things we mentioned before. If there's locking of the knee and part of the meniscus is blocking the movement, then surgery might be the only answer. If you're one of those unlucky ones that need a surgery, what are the options? So number one is meniscectomy. Meniscectomy essentially means removal of part or complete meniscus. So a total meniscectomy, which is removal of the whole thing, is a procedure of the past. Doctors tend not to do this anymore because we know that this increases risks of osteoarthritis 14 times over 20 years period. The more common, potentially a bit better option is a partial meniscectomy. So that's when a part of the meniscus that is injured is removed. However, research shows that even with this procedure, you're more likely to develop osteoarthritis earlier. The second group of operations is meniscus repair. These are becoming quite popular recently. Now in this operation, a surgeon tries to stitch the meniscus together and then allow it to heal. The success rate depends on the area of this tear. If the blood supply is good in that area, then you're more likely to benefit from it. There are some uncommon surgical options as well. One of them is meniscal reconstruction. So that's a procedure when an allograft is used. An allograft can come from a cadaver, from a dead person, or from another animal. And lastly, meniscal scaffold. A biodegradable scaffold is made either from collagen or polyurethane that allows meniscus to grow back.
So there you have it, all about meniscal injuries, and a lot of this will depend very much on an individual case-by-case basis of which decision and route that you go down. But hopefully this has given a bit more information around the condition and the kind of options available. Please subscribe for future videos, give us a like, and we will see you on the next one.